Every morning begins the same, until one day something stops you. A simple movement becomes a struggle, and the shoulder you always rely on suddenly refuses to move. This is the story of Hakim. According to Zuckerman 2011, frozen shoulder, also known as adhesive capsulitis, is a fibrotic inflammatory condition of the glenohumeral joint capsule. It is clinically defined by a significant restriction of both active and passive range of motion, particularly in external rotation, in the absence of known intrinsic shoulder disorder. The pathophysiology of frozen shoulder is divided to three phases. The first phase is a freezing phase, inflammatory, the duration around 2 to 9 months. This phase is driven by an acute inflammatory response. The synovial joint lining undergoes hyperplasia and neogenesis, growth of the new blood vessel and nerve endings, which explain the severe natural pain. Second, frozen phase, fibrotic, the duration around 4 to 12 months. Inflammation subsides and a fibroproliferative scarring process takes over. The joint capsule thickens and contracts, obliterating the axillary races and restricted movement. Lastly, the thawing phase, remodeling, duration around 6 months to 2 years. The mechanism is the dense collagenous scar tissue gradually undergoes remodeling, the tissue softens and the capsule volume expands, allowing for a slow return of a range of motion.
The research by Brandisino 2024, those who are at high risk of getting frozen shoulder is a diabetes patient, thyroid disorder patient, previous shoulder injury, and age between 40 to 60. Now, let's see what are the signs and symptoms for the frozen shoulder. First, constant shoulder pain, stiffness in all directions, trouble reaching object or the overhead movement, and difficult to sleep on the painful side. And last one is a reduced daily function, such as wearing clothes.
The FA scratch test. This test is a key shoulder mobility assessment for frozen shoulder or adhesive capsulitis. The patient is in a relaxed position. There are two movements that will be tested. First, external rotation and abduction. Ask the patient to reach their arm overhead and behind their neck, trying to touch the top of the opposite shoulder blade with their finger. Next, internal rotation and adduction. Ask the patient to reach their arm behind their back and try to reach up towards the opposite shoulder blade, or down toward the lower back with the back of their hands. Remember, this test need to start with unaffected side first, followed by the affected side. The positive sign for this test is if the severe pain occurs during this movement. According to the Jiva Navar 2022, showed the dominant side shoulder to have more positive value following to the FA scratch test compared to the non-dominant side.
Okay, next, stick exercise. This exercise helps to improve shoulder movement, reduce stiffness and pain. First, hold the stick with the both hand while sitting or standing. Use the stronger arm to help to move the weaker arm. Slowly move the stick up to the side or outward until you feel a gentle stretch. Hold for a few seconds, then return to the starting position.
Research by Salviani 2023 demonstrate that the Kopman pendulum exercise significantly reduces pain in individuals with frozen shoulder. The exercise is performed by leaning the trunk forward while supporting the body with the non-effector arm on a stable surface. The effector arm hangs freely and moves gently using gravity to produce small circular forward-backward and side-to-side motion with minimal muscle activation. According to the FITT principle, the exercise is performed at low intensity for 30 to 60 seconds per direction and repeated 2 to 3 times per day.
According to Tembin 2025, show that modified wall stretching exercise such as the finger wall ladder can produce immediate improvements in shoulder flexibility and range of motion. To perform this exercise, stand facing a wall and place the fingertips of the affected arm at chest height. Slowly walk your fingers upward along the wall, allowing the shoulder to lift gradually. Stop at a comfortable stretch without pain. Hold briefly, then walk your fingers back down in a controlled manner. Based on the FITT principle, this exercise is performed at low intensity with 10 to 15 repetitions, 2 to 3 times per day.
according to DEC 2004, they said that patients with frozen shoulder need to do first, simply stretching to prevent lingering pain of the shoulder. Second, do not sleep on the affected side. Lastly, if the patient feels pain, the patient need to apply a hot towel around 10 to 15 minutes as a pain management. In conclusion, frozen shoulder or adhesive capsulitis progress through freezing, frozen, and thawing phase, leading to painful stiffness that restrict daily movement like reaching overhead or behind the back. The ability tests effectively show mobility limits by comparing affected and unaffected side, while risk factors such as diabetes, thyroid issues, age 40 to 60, injuries, and sedentary habit increase vulnerability. Early physiotherapy intervention like Cockman pendulum and finger wall ladder exercise guided by FIDT principles swiftly ease pain, preserve motion, and reboot function with gentle gravity-assisted or wall-supported action performed daily at low intensity. Overall, timely recognition through simple tests and consistent rehab and recovery, restoring shoulder freedom without invasive measure.